Yep.
So for more on that crowded, mostly maskless scene last night, let's turn to infectious diseases physician and medical director of the Special Pathogens Unit at the Boston University School of Medicine, Dr. Nahid Bhadillia. She's an NBC News and MSNBC medical contributor. Dr. Bhadillia, good morning. It's great to have you with us, as always. As a public health expert, as a physician, what do you see when you look at these pictures of President Trump addressing that big crowd, sitting shoulder to shoulder, most of them not wearing masks? We also can confirm that most of the people there last night were not tested for coronavirus. Only those who would be in close proximity to the president, the first couple rows, the family, were tested, but not that larger crowd. What do you see when you look at those pictures?
Well, we're at a stage in the pandemic where you no longer need a doctor like me to tell you that that's dangerous. I mean, I think that it's good that it's outdoors, but the elements of this that make it dangerous is how crowded it is, how close together people are, the lack of absence of both the testing and the mask, but the fact that they're sitting next to each other for such a long period of time means that, we now know about this disease, that this virus that sticks around in the air longer than we expected. That's that whole conversation about airborne versus droplet. So this is truly setting up a situation where people may get sick. But the true danger of this, Willie, is not really what happened last night. The problem is, we've now come to a point where cases are improving. We're seeing hospitalizations go down, even though the deaths are over 1,000, as Mika said earlier. And the reason why is because Americans have started to use masks more. There are more, mask mandates. People are distancing. They're taking this to heart. And when people see this, the concern is that they're going to let their guard down as we face down the barrel of the fall and what the CDC calls potentially one of the worst falls that we might have in this country. And so to me, this is the president once again doing the same thing he's done with the pandemic. He's been dealing with it as a political problem, one that you can spin away, one you can narrate away and push towards normalcy, versus a public health problem where you have to face the data, where you have to do the hard work to make the situation safer.
Yeah, that crowded maskless scene provided the visual to the argument he was making in his speech and what they've been making over the course of this week at the Republican National Convention, that coronavirus is something over which the country has triumphed, that it's somewhat in the rearview mirror. In fact, the president last night pointed to Mike Pence, asked him to stand and receive an ovation for his leadership on the coronavirus task force. What do you think when you hear that? I mean, you're studying this every day. You're looking at the numbers. You pointed out to some good news in terms of cases and hospitalizations. But what does it mean to have that kind of messaging come out again and again every day from the White House?
Well, Willie, you've known me long enough to know that I drag my feet trying to not to be political about public health. And the reason why is because in most cases, politics doesn't help. But in this case, it's become so clear to me over time that the reason this pandemic, as bad as it is in this country, is because our governance hasn't taken the steps that they need to. Every time this administration has tried to muzzle their public health experts, every time they've put out, benefits of a drug that don't exist, every time they've exaggerated the benefits of drugs that don't exist, every time they've dragged their feet on not wearing a mask, because, wearing a mask shows that we're in the middle of a pandemic, is a visual cue that we need to change our behavior. They have added to worsening this pandemic in this country. The most, I think, damaging thing for public health experts, this is one of the worst weeks for public health experts, not in the case and the death aspect, because we're at a worse place in July, but because this week, 2 federal public health agencies had to be were pressured by the administration. The FDA basically touted efficacy data that even Mayo Clinic, who conducted the study on convalescent plasma, said they don't know how they got that efficacy data, and then had to walk that back. The CDC just released guidance that the rest of us are looking at this going, that downplays the importance of testing in asymptomatic patients. This is a crisis. The erosion of trust in public health authorities is going to be long lasting if the White House continues to use them in their political game in trying to normalize the picture around the pandemic.
All right. Thank you so much, as always, Dr. Bhadillia. We greatly appreciate it. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.